the infamous continuum of taking data and creating information out of it that's meaningful and has value in one way or another is really at the crux of what Truveta is about.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I think the goal here is to present that macro view. Healthcare systems, as you know, has been on a journey for digitization of a lot of health information for past 2 decades, but never that information had a significant opportunity to expand beyond the 4 walls of the health system itself. So Truveta-like opportunity in particular for us is a great opportunity in terms where we can go together with like-minded health systems and build that continuum care data together, bring that macro piece of the puzzle together, and then apply to some of the very pressing questions that we have within healthcare on equity part of the healthcare, on delivering the care in terms of applying it to newer disease, newer therapeutic categories and such. So we are looking for bringing that macro piece together and an economy of scale with other health systems.
What's the difference between now and in previous decades as data has been accrued, around the world? Well, now we have the ability to structure and normalize data, and on top of that, apply artificial intelligence to really make queries, to make insights in ways that otherwise we've not necessarily had the capability to do in an agile manner. And that's the amazing part of why now makes a lot of sense. We'll have the ability for Bon Secours Mercy Health to have really a structured and normalized data lake that we'll be able to use for our own purposes internally across the communities that we serve. And in addition to that, have the macro data set that the Truveta combined data community is providing, and glean insights from that as well too. So ultimately, the observations when we start thinking about socioeconomic disparities of care, efficacy with new and emerging treatments, as well as really the epidemiology of things. And I mean, what better time now than with COVID to try to expand on those type of capabilities in a nimble and agile way, where we need to have understanding of the efficacy of different treatments and how our responses to those epidemics are proving to be beneficial or not.
If you begin to deliver a care in every setting tends to take different pathways, and often when one patient is treated is in one market versus another patient is being treated in another market, there are different choices that medical professionals are making in delivering the best care possible. But what happens when you start looking at these pieces, the same disease gets treated differently in different settings by different choices being made. And sometimes those rationals do make sense, and sometimes that variability is something that costs our health system quite a bit. So not just from providing the best clinical care, but also from a cost of the delivery itself. So understanding one of those examples is to understand that variability that exists at a macro level can begin to answer a certain set of questions and give insight as to what do we need to standardize and normalize, and what do we need to tell our medical professional and our patients that this is the best possible way to get the best clinical outcome at the lowest cost. So how do we make those equations work? That level of analysis is a perfect example of what you can do with that data.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit BusinessJournalDaily.com. For all of your arts and entertainment news, go to AfterHoursYoungstown.com.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.